Welcome to HeartTalk, presented by Capital Cardiology Associates. I'm Michael Arce, joined by Dr. Lance Sullenberger, a board-certified cardiologist with Capital Cardiology Associates. Welcome, Dr. Sullenberger.
Thank you for having me.
May is National Stroke Awareness Month. How is a stroke different than a heart attack?
A stroke is different than a heart attack in that a stroke is an attack of the brain, where you are killing brain cells and losing part of your brain tissue.
More than 200,000 cases of stroke will be diagnosed this year in the United States, yet a majority of strokes are preventable. Dr. Sullenberger, we are seeing people as young as 40 that have a stroke. What factors put a person at risk of stroke?
The risk factors for stroke are very similar to those for heart attack. We worry about things like high blood pressure, diabetes, smoking, poorly controlled cholesterol, and obesity. Also, some other factors that we worry about in stroke. Things like atrial fibrillation, also known as AFib, and occasionally holes within the heart which haven't been diagnosed previously.
Luke Perry's sudden death from a stroke earlier this year shocked us all. Is there a way that you can assess or detect a patient's risk of stroke?
Mike, since risk factors play such a role in the risk of stroke, it's important that patients know their blood pressure, know their cholesterol level, know whether or not they have diabetes. It's also important that they maintain a healthy lifestyle, things like not smoking, maintaining a healthy weight. In addition to that, it's important that you know your family history, whether or not other members of the family have had stroke, and you be evaluated if you have any symptoms such as palpitations or anything that could be a neurologic symptom like loss of vision, weakness on one side of the body, or slurred speech.
For stroke survivors, what treatments or changes are available to prevent another stroke?
To prevent another stroke, it's important that patients have a very tightly controlled blood pressure, that they be on cholesterol medicine such as a statin, and they take an aspirin every day. In addition to that, if the stroke was caused by something such as AFib, they should be on a blood thinner. It's also important to get regular checkups with their physician and that they change their lifestyle, things like stopping smoking, exercising, and having a healthy diet.
Thank you, Dr. Sullenberger. This has been HeartTalk presented by Capital Cardiology Associates. To learn more about the conditions and procedures we discussed today, visit us online at capitalcardiology.com. That's capitalcardiology.com.